being here today and investing your time with us. My name is Lauren Henderson, and I am the Director of Community Partnership Programs with Junior Achievement of the Palm Beaches and Treasure Coast. And we are very excited to be here today, continuing our Invest in Your Health Medical Career Speaker Series this week. And today we have an incredible speaker from Hospital for Special Surgery in Palm Beach County, also referred to as HSS. You may have heard of it. And we're really excited. You're going to hear from Miss Heather Woolf. She's an experienced nurse and healthcare leader with over 20 plus years of experience. And during that time, she has helped run clinics and hospitals, and she's helped the staff not only with running the hospital or clinic, but she's also helped teach future medical professionals, and she helps with patient care and improving that. So please help me welcome Miss Heather Woolf.
Thank you. Thank you, Lauren, for that great introduction. Thank you for having me today. I'm really excited to be here with all of you. And if you don't know what Hospital for Special Surgery is, all we do is take care of the muscular skeletal system. So the bones and our doctors do that every day, all day long. And we're the oldest MSK healthcare system in the entire United States. We were opened in 1763. Does anybody know what was going on in the United States in 1763? Anyone like history? And what's your name? Go ahead. Hi, Kathleen.
They were going to war.
That's right, Kathleen. It was the Civil War. So that's how long HSS has been taking care of patients and their bones, which is really, really cool, right? So I'm really excited to be here today. Today, I'm going to talk about healthcare administration. And really what that is a really fancy way of saying leadership in healthcare. So it's a big word, administration. But really what I do every day is I help people that take care of patients get done what they have to get done. Okay, so there I am. And that's my email. If you all have any questions that I don't answer today, please feel free to send me an email, or if you're thinking about it afterwards. I love to help students as they learn about what we do. All right, so I'm really old, so I've been doing this a long, long time. I grew up in Massachusetts. I moved there when I was 5 years old, and I was raised by my mom and my grandmother. My mom was a single mom, and my grandmother was a big support, and we all grew up in the same house together with my brother. And I learned the value of hard work from my mom and my grandma. So my mom and grandma each worked 2 jobs all the time. So from the time I was younger than you guys, my mom was a secretary, and she worked as a nursing assistant at night in a nursing home. And my grandmother worked in a factory, and she helped build boxes all day, and then at night worked in a restaurant. So what that means was I had to be really independent from a young age. I was what was called a latchkey kid. And it was a really interesting way to grow up, and it taught me the value of hard work, because I knew I didn't want to work 2 jobs my whole life. So I also knew that I liked helping people. So I got through high school. I started in the restaurant business when I was 14 years old. I started bussing tables. Do any of you want to have a job when you're a freshman in high school? Yes. Yeah, it's wonderful, right? I had pocket money, and I could go buy like the shoes that I wanted, because my mom and grandma didn't have a lot of money. And it taught me the value of showing up on time and doing things the right way. So I thought I was going to go into the restaurant business. And the most important thing that I want you all to learn today, other than what we do, and this is a really cool area in healthcare to work, is that there's not a path that's the same for everybody to get to what you're going to do in life. And I think that like TikTok and I think Instagram, it paints a picture that there's a perfect world, that maybe some of you are going to go to college and you're going to get your degree and you're going to do what you dream of doing forever, but that's not the case for everybody. Everybody has a different path that they take, and it's okay. So if you graduate and you don't go to college right away, that's okay. But I promise you, if you do the right thing and you work hard, you're gonna wind up exactly where you're supposed to be. So I graduated from high school in 1995. Oh my goodness. I did go to college, but I dropped out my sophomore year. I went to college and I dropped out. My grandma, who helped raise me, got really sick and I didn't like being away from home. So I came home and I helped take care of my grandmother until she passed away. And while I was doing that, I loved watching the people in the hospital. Whenever we were in the hospital, these amazing people would come into my grandmother's room and they would clean her and make her comfortable. They would feed her. And I just thought it was the most amazing thing that I've ever seen. So I said, that's what I want to do. The first time I went to college was for business school. So I started all over. I became what's called a patient care tech, a PCT. They do have those roles down here in Florida, but you may know them as a CNA or certified nursing assistant. These are the most important people in a hospital, and I'm going to tell you why. The doctors and nurses are really busy, and these people are the ones that spend the most time with the patients and can have the most impact on their care. So I would have a patient assignment, and I would get them ready for bed. I would bring in their food. I would feed them if I had to, make their beds, and just help the nurses with whatever they needed all day, every day. And it was wonderful, and I just loved it. So after doing that for a couple years, I was looking at the nurses, the registered nurses, and I thought, I could do that. I think I could do that. So I went to nursing school when I was 23 years old, and I was married. I had gotten married, and I went to a community college, and I had a fabulous education. And I had the most wonderful teachers who taught me how to be a nurse. And then I graduated and I was a registered nurse. Then I had my son. My son was 1 year old when I graduated from nursing school. I had a little baby and I was 25 years old. And I decided I didn't like the cold weather anymore. Have any of you ever been to Massachusetts or New Jersey or New York? Raise your hands. Have you ever been there in winter? Is it cold? Yeah, it's really cold, right? I was tired of the cold. So I moved down here to Florida in 1995 and started working as a nurse in the hospitals here. And I did all sorts of things. I was a hospice nurse. Does anybody know what a hospice nurse does? What's your name?
Nathan.
Hi, Nathan. Tell me what a hospice nurse does.
Well, hospice is where patients go when they don't have any treatment that can save them. So a hospice nurse helps take care of them until they pass away.
That's right. So I was a nurse, and I would come in when a patient had 6 months or less to live, and I would take care of them until they passed away. And it was very, very rewarding. I was an emergency room nurse. Anyone here want to work in an emergency room one day? Yes. Exciting, scary, fun. And so I did that, and I worked in all different settings. And then I started working in home health. I took care of patients in their homes. And then in about 2007, I started leading. Somebody came to me and said, hey, Heather, we think you would make a great nurse manager. The other nurses look up to you. They like to come to you for questions. You're always helpful with them. Would you like to be a nurse manager? And I have a rule. And my rule that I tell all my students at FAU is that if your boss comes to you and says, hey, do you want to do this extra thing? The answer is always yes. Even if you love what you're doing today, it gives you the opportunity to learn something new. And guess what? That's leadership. Sometimes in leadership, we do things that aren't on our job description. And it's always worked out really nicely in my career. So I became a nurse manager. Then I started doing medical sales in home health. I would go to doctor's offices. That's another amazing career. And I would tell them all about the home health services of the company that I was working at. And then one day I got a call from a coworker who was working at Good Samaritan Medical Center. Do you guys know where that is? Has anyone heard of Good Sam? It's right down the street from here, and it's a wonderful hospital. And they needed a chief strategy officer to help them recruit physicians to the hospital, which is a job as well. You guys are going to hear about a lot of jobs from me as I'm talking. So I moved over to the hospital and I became a hospital administrator, which is another way to say a leader at a hospital. And I got to work with doctors all day, every day, and help them get everything they needed to do surgeries at the hospital. If they had any questions about nursing care on the floor, I got to work with an amazing team of other hospital leaders to support doctors to take care of patients every day. And then they came to me and said, hey, Heather, we need someone to move over and help the physicians grow their businesses. So do you guys know healthcare is a business? Healthcare is a business. I remember when I was a nursing student, I was doing a rotation at a little hospital called Holyoke Medical Center in Holyoke, Massachusetts. And I was so excited. It was my first day on the floor. And I went into the supply closet. I had to get some oxygen tubing for a patient. And my professor, Professor Ian, he said, Heather, when you grab that oxygen tubing, you have to save the sticker that's on the tubing. You have to put it on your clipboard. We were still using paper back then. And I said, why do I have to use the sticker? And he said, Heather, that costs money. And we have to bill for that. And we have to make sure that we get reimbursed for that. And that's when I started to learn. Healthcare is a very complicated business. So I moved over and I started helping physicians run their practices. Doctors are really good at a lot of things, amazing things, but they want to focus on medicine. They don't always want to run their practice, right? They don't always want to make the hard decisions, fire an employee, hire an employee. There's all sorts of things to running a doctor's office that hospital administrators do. So I'm still doing that today at Hospital for Special Surgery. Also, I teach FAU. That's always been a dream of mine to be a teacher. So I teach there too, and I teach college students there how to be healthcare leaders. I am married. My children today are 25 and 20. Oh my gosh, I'm getting so old. And my 20-year-old is right now taking classes to be a certified nursing assistant, and I'm so, so proud of her. And my son is a marketing manager, and he helps people grow their business in marketing. And I like to eat. I really like to eat. I like to go to the beach, and I love to learn. So that's just a little bit about me and how I got here today. Okay, so what do? Healthcare administrators. There's lots and lots of things healthcare administrators do, and it is complicated. But just to sum it up, we support patients, physicians, nurses, people cooking in the cafeteria at the hospital. We help the EVS staff, our wonderful EVS staff. We help them remove barriers so they can do everything they need to do every day to take care of patients. So even though I'm not a hands-on nurse anymore, and I'm not helping people give them their medicine and at the bedside, I still help the patients by making sure that all those people have what they need on the business side. And we care about quality. We have to make sure that if you have to come to this hospital or someone that you love has to come to the hospital, we want to make sure that it's really safe and that we give the best care possible. And we support all the way down the front line to do that. And we help fill in gaps in the community. So say there's a hospital and you can't have a baby there, but there's lots and lots of young people in the community getting married and they need a place to have a baby. I would work with the hospital leadership team in my role and help recruit the physicians to the community that could help deliver the babies, okay? Okay, there's lots and lots of titles in healthcare leadership and administration. There's so many options. And this is the wonderful thing about leadership in healthcare. So some of the titles, CEO, yes, there's a CEO in every business, including healthcare, the chief executive officer, the chief operating officer, and they help things get, if the furnace goes down in the hospital, the chief operating officer's team would try to get that furnace up and running again. Or if a storm was coming, they would have to make sure that the hospital or the physician practices were secure for the storm coming in. A chief nursing officer. This is the hardest position in healthcare, in my opinion. The chief nursing officer has to make sure hundreds of nurses in the hospitals or in the ambulatory setting or in the surgery center have everything they need, and there is a big nursing shortage. So if any of you want to be nurses, woohoo, yes, I see lots of hands. It's a wonderful profession and we need you. And then you need to become nurse managers, right? So nurses need somebody that they can go to ask for what they need to care for their patients, and that's a nursing leadership role. And if you love numbers, does anybody love numbers? All right, we have some numbers people in here. I love that. Chief financial officer. Remember, it's a business, and I had to take that sticker and I had to save it. We have to count all that money, and we have to keep the business going so that the hospital can stay open or the physician practice. And that's what the CFO does. And if any of you want to be a doctor, anyone want to be a doctor? All right. So we have physicians who lead alongside us. It's called dyad leadership. Every healthcare administrator has a doctor that they partner with to run whatever area of healthcare they're working in. Director of Business Development, Gina Kelly, is here in the back of the room, and she works with us at HSS. Hi, Gina. Such an important role because Gina has to get out into the community and make sure everybody knows about HSS and everybody knows about our amazing quality so patients know where to go for care. She's an educator as well. So lots and lots of cool jobs. This is a long list. This isn't even half the list. There's so many wonderful things you could do to lead in healthcare if you want to lead. Okay, so here's a day in my role. All right, Heather, what do you do? How hard do you work, right? I work really hard. Anyone in healthcare does. And if you want to be in healthcare, guess what? Healthcare is open 24 hours a day, 7 days a week, 365 days a year, right? So there's a patient in a hospital bed on Thanksgiving Day, whatever holiday that you love and it's your favorite, there's people in the hospital working to make sure that they're taken care of. So if you want to get into healthcare, you're gonna be aware of that. So I'm usually in the office around 7:30. Sometimes if I have physician meetings, I might start my meetings as early as 6:30 in the morning. Because if you're a surgeon and you have to go do a surgery at 7:30 and you're in the OR all the way, sometimes if you're a trauma surgeon, you could be in the OR for 15 hours. The only predictable time that they have is very early in the morning. So I do a lot of early mornings with doctors. But if I don't have a physician meeting, I'm usually there at 7:30 to get the clinic going and make sure my team has everything they need. And usually I'm there till like 5:30 at night. I do have a lot of, when you're a leader in healthcare, there's all sorts of really cool committees you can be a part of to help make sure you have the highest quality care. So a lot of those committee meetings are after hours. Our board meetings are after hours. We have meetings called Medical Executive Committee where all the doctors that are leaders come together and we all make decisions together. And those are usually after hours. And we do a lot of community outreach on the weekend because when you work in healthcare, it's your job to help the community in whatever setting that you can reach them. So we do all sorts of cool things like walks in the community, we sponsor them, we educate, all sorts of good stuff. So what do I do all day? Right now is budget season. So right now my brain is full of numbers. I am building the budget with the finance team and my chief financial officer for what it's gonna look like next year. So look, I'm a nurse, right? I did not like numbers. But I said yes. Someone said, Heather, do you want to try this? And I said yes. And now I can sit down and build a budget and launch a new service line and put the numbers together with my finance team. And it's really, really cool. So right now I'm doing budget planning, which takes months, by the way. It's a whole other lecture in itself. I do a lot of physician meetings. I already talked to 2 of my doctors this morning who needed some help. So I talked on the phone all day with doctors. I recruit new physicians. I do contracts and I recruit new doctors to our organization in the area. I work with hospital administrators, even though I run practices, I talk to them all the time. And anything my team needs. I have a big team who helps me, and they really run the organization, and I'm in the background just making sure that they have what they need. All right, so I wanted to just share a couple lessons that I've learned as a healthcare leader and a life living person, right? So when you are taking care of people and you're in the community and you're trying to be the best example that you can, which wherever you sit in life, this is what you should do, right? You want to give back. You want to show up to your job. You want to do the best job you can so that you go home and you feel good and you know that you're helping. So lessons learned. Listen more and talk less. My grandmother used to say, you have 2 ears and you have 1 mouth. And there's a reason for that. That's an old saying. Does anybody know anyone that just talks all the time and never listens to you? Yeah, I see lots of hands. Be a listener. Healthcare is about listening, especially to your patients if you take care of patients, okay? So zip the lips and listen. Never assume, collect the facts. Do any of you ever have a friend or a brother or sister? I have 8 siblings. That 7? Okay, I got 7 over here. Anyone want to have 8 or more? Oh, yes, I win. And lots of mine are brothers. You have 9. All right. Okay. It's a lot, isn't it? It's a lot. So maybe you know somebody who just gets really upset and they didn't even hear the whole story of what you were trying to tell them yet, right? And when you're a leader, you can't do that. You have to step back and you have to collect the facts so you don't react, right? You want to take a step back, don't react. Find a mentor. Can anyone tell me what a mentor is? Anyone know? What's your name? Angel. What's a mentor?
It's like someone that you can talk to and not go back and tell anyone else.
That's right. So somebody you can talk to and they won't go back and tell anyone else. Yeah. Someone you look up to maybe. Someone that you look at them and you go, wow, that person is somebody that I hope to be one day. And they have the most wonderful qualities and I want to be just like them. That's what a mentor is. And you guys could all have a mentor right now. Maybe it's someone in your family. For me, when I was your age, my grandma was my mentor. My grandma took such care of me and she never got upset and she was someone I could always talk to. And now today, I have CEOs in healthcare as business mentors that I can call when I'm at a tough spot and I'm like, gosh, I need some advice. So have a mentor. Your reputation is number 1. How you behave in life is going to follow you everywhere. Every decision you make. Now, that doesn't mean you can't make mistakes. You can make a bunch of mistakes. And the good news about that is if you do make mistakes, you can fix it and you can course correct on a different path. But your reputation is everything. Even now, when you guys are students, you're going into high school. Maybe some of you want to think about a technical school, college. Maybe you just want to go to work and be the boss and own your own business. None of that is going to happen the way that you want it to happen unless you carry your way yourself in a manner that other people know of your good reputation. And then it all comes out in a wash. I keep going back to my grandma. This is another one. If the world seems like it's ending today, if you're having the worst day in the world and you're at work, it's going to be okay. It's all going to come out in the wash. 6 months from now, you might remember what happened, but it's going to be okay if you have the right attitude. All right? And then just really quickly, healthcare leadership. Do you like to work with people? You might be a good leader. Do you like to solve problems? I solve problems every day. Are you patient? Can you listen to people? That's really important. Do you get along well with others? Do you guys get along well? Anyone get along really well with others? That's the key. You have to get along with people from all different walks of life, right? Do you have a lot of energy? Boy, the older, yes, I see lots of hands. Yes, you have to have a lot of energy to get up and work a 12-hour day, right? Solve problems. And I'm getting a little older, the energy's fleeting a little bit, but if you're naturally motivated and have energy, this is a great job for you. Do people look up to you? Remember your reputation. Do people come to you for advice? Do people want to talk to you, be around you? And are you comfortable with unpredictable situations? If you're the kind of person that you like your day the same every day, and that's wonderful too, that leadership might be a challenge for you. You might have to get out of your box because I can think my day is going to go one way and I get in and forget it. The train goes off the tracks. And then I just want to share a quote from one of my very, very, very favorite leaders, poets, speakers. She actually went to college in the town that I grew up in, Maya Angelou. Does anyone know who Maya Angelou is? If you don't, find out. She's amazing. I've learned that people will forget what you said. People will forget what you did for them. But people will never forget how you made them feel. All right? So I want to leave you guys with that because leaders are supposed to leave people feeling confident and good and fix things and make things all right in their world. Okay? So that's it.
Like, since you're in high school, it like open you up to everything in